So here you can see this is sternocleidomastoid. So which divides the neck into anterior and posterior triangles. This is the posterior triangle and this is the anterior triangle. So in the anterior triangle, what is the boundary? Posteriorly, we know that the anterior body of the anterior margin of the sternocleidomastoid above by the chin and base of the mandible, angle of the mandible, and from here one imaginary line which joins the angle of the mandible up to the sternocleidomastoid muscle. That means chin, base, angle, and the imaginary line up to the mastoid process of the temporal bone. So this is the boundary, and in front there is the midline of the neck. We will get some structures at the midline of the neck from above downwards. Okay. So this is the boundary. Now there are some landmarks. If we go below the chin, then we can feel one bone, that is the hyoid bone. Then we can go below, we can find thyroid cartilage, or it is also part of the larynx or Adam's apple. Then we can, if we go below, we can feel the isthmus of the thyroid gland, and then we can feel the tracheal rings. Okay. So from the thyroid to hyoid, there is one membrane which is called thyrohyoid membrane. From thyroid to hyoid, one membrane is there. There is the thyrohyoid membrane. Okay. So these are some structures, and ultimately here we can feel the isthmus of the thyroid gland, and below if we can feel, there is a tube-like structure, that is nothing but the trachea or tracheal rings we can get. Incomplete C-shaped cartilages we can get. So chin, thyroid, then we can feel the isthmus of the thyroid gland, then we can feel, if we press, you can feel one tube-like cartilaginous tube-like structure, that is the trachea, and just then more below we can get the suprasternal notch. Okay, so these are some structures we can get, and also now if we dissect the neck, first what we have to cut? We have to cut the skin, and we have to reflect the skin. Suppose I have made one incision along this line, okay, from the chin, along the base of the mandible, angle of the mandible up to the mastoid process, then from the midline, along the midline up to the suprasternal notch, then I can reflect the skin. Below the skin, what we can get? Superficial fascia, we can get some veins also, we can get. In the midline, we can get one vein. There is the anterior jugular vein. And below the skin, we can get one cutaneous muscle. If I can taut this muscle like this, I can see this platysma muscle. Okay. This is a subcutaneous muscle just below the skin. So I have to remove, and we know that is origin is from the second space, okay, second costal cartilage, and it moves up to the angle of the mandible, and then it is continued in the face as rhizorius. So I have to cut that muscle, and if I cut that muscle, then what we can get? Skin removed, superficial fascia removed, that is the subcutaneous muscle is removed, then we can get deep fascia. And within the neck, it is interesting to note that deep fascia is oriented like a cylinder, concentric cylinder, one big cylinder outside, then another middle cylinder and innermost cylinder. One cylinder is investing all the neck. Okay, so that big cylinder is called the investing layer of the deep cervical fascia. Then we can get concentric middle cylinder, that is in front of the trachea. So pre-tracheal layer of the deep cervical fascia, and most inner cylinder of fascia, that is the pre-vertebral layer of fascia. So when we will remove the skin, superficial fascia, platysma and all, we can get the investing layer of the deep cervical fascia. So it covers all the structures in the neck. Okay, you will know its disposition in the separate class, but here we can encounter, when we are dissecting, we can see there is investing layer of the deep cervical fascia. And here we know in the deep fascia, it covers the muscles, vessels, nerves. Okay, so the muscle we will see, definitely this is the sternocleidomastoid. Another muscle we can see which originates from this is that muscle from the digastric fossa of the mandible, which is present here. From the digastric fossa of the mandible, this muscle is ultimately it forms a loop-like structure, and ultimately it is connected to the mastoid process of the temporal bone. That muscle has got one anterior belly, one posterior belly. So it looks like a triangle. Okay, this is the anterior belly and this is the posterior belly. And this posterior belly is accompanied with another muscle which is from the styloid process of the temporal bone to the hyoid bone, that is the stylohyoid. Okay, muscle. So here we can find this muscle. This is the digastric muscle, which has got anterior belly and which has got posterior belly, and in between we can get the central tendon of that muscle. So that is a very important muscle, and then we can get another muscle which is we can find it in the scapula. One attachment is that of scapula. It moves upwards and medially, okay, and ultimately it is attached to the hyoid bone. So that muscle looks like this. That is called omohyoid muscle. Omohyoid. Omo in Bengali, nomo, omo. Okay. So it looks like this. So it has one superior belly and inferior belly, and that muscle has got also a central tendon which is concealed within the sternocleidomastoid muscle, which we cannot see, but there is a central tendon. So that part is the superior belly or superior belly, and this is the inferior belly of the omohyoid muscle. Why I am concerned with so many muscles? Because this anterior triangle is being divided by this digastric muscle and omohyoid muscle into several sub triangles, and they are in front of the digastric triangle. We can find one triangle, that is the Submental Triangle. Within the anterior and posterior belly of the digastric, we can get the digastric triangle. Here, this triangle which is been contributed by the posterior belly, posteriorly by the anterior border of the sternocleidomastoid, superiorly and anteriorly by the posterior belly of the digastric, and inferiorly and anteriorly by the superior belly of the digastric. So we can find one triangle here. That triangle is called Carotid Triangle. This triangle is called the Carotid Triangle. Okay, because we can find one of the major arteries of the body, that is the carotid arteries. That is the common carotid artery which divides into external and internal carotid artery at the level of upper border of the thyroid cartilage. Okay, so here we can see the different branches of external carotid artery. We are not concerned with internal carotid artery. Common carotid artery divides into one is external and one is internal. We are not concerned with the internal one, because here in the neck, because only this external carotid artery is we are concerned, because we can get so many branches, and those branches we can find within the carotid triangle. So that's why what is the meaning of the carotid? Carotid means sleep. Just now you want to sleep. Why? When both the carotid arteries are pressed, what will happen? Supply to the brain will get affected, and there will be a sleepiness, the development of sleepiness. Right? So that is carotid means sleep. Not all these things are available in your textbook. Okay, that's why you have to come into this class. Okay, you have to come, you have to attend this class. Carotid means sleep. Okay, so that is carotid triangle. So submental triangle, digastric triangle, carotid triangle, and one triangle is in front of this superior belly, and this muscle is sternocleidomastoid. So here at the midline of the neck, just on either side, we can get another triangle that is called muscular triangle, because we can get so many muscles. This hyoid bone is the key bone here for the muscular triangle, because some muscles are attached above the hyoid and some muscles are attached below the hyoid. So these muscles are called suprahyoid muscle. One group of is below the hyoid. So those are called infrahyoid group of muscle. Suprahyoid, from the mandible to hyoid. We know there is a mylohyoid line here. From here to hyoid, one muscle which forms a slope or diaphragm like, that is, which is also called the diaphragm of oris, but that muscle is mylohyoid. From mylohyoid line of the mandible to the hyoid bone, mylohyoid. Geniohyoid, from genial tubercle inside to the hyoid bone, geniohyoid. Okay, mylohyoid, geniohyoid. So these are muscles which are, and hyoglossus, from hyoid to the glossus means tongue. So hyoglossus. So these are some muscles which are present above the hyoid. They are mylohyoid, geniohyoid, hyoglossus. So these are muscles are attached above the hyoid bone. This hyoid bone is very important, not only for the anatomist, but also for the forensic medicine, or forensic for the forensic medicine and toxicology. We know there is a FMT, there is one subject, because in case of hanging, in case of throttling, if somebody throttles, what happens? This hyoid bone will get damage, or actually there will be fracture of the hyoid bone. Because hyoid bone, because this is very important for our, not only for, it is important for our attachment of different muscles and also for movement of the larynx. Okay, so that is very important. So below the hyoid, we can get infrahyoid group of muscle. From hyoid to sternum, tell me the name. Just deduct the name from hyoid to the sternum. Stylohyoid. This is thyroid. From sternum to thyroid, sternothyroid. From thyroid to hyoid, thyrohyoid. So, which muscle should be superficial? The stylohyoid or sternothyroid? Because from sternum to hyoid, it has to go for a long distance. So, it should be superficial, that is stylohyoid. Then sternothyroid. And from here to the hyoid, the thyrohyoid. So all these muscles are attached below the hyoid bone. So this is the hyoid bone. Above we are getting geniohyoid, mylohyoid, hyoglossus, These are all the muscles we are getting. Okay. There are other muscles of the tongue, we know. Okay. So, below the thyroid, below the hyoid, we can get. So, we can get sternohyoid, sternothyroid, thyrohyoid. So, these are the muscles. Okay. So, in the muscular triangle, we can get all these muscles, and these muscles looks like a strap. So, they are called strap muscles, strap muscle. So, here we can get the subdivision of the anterior triangle. This is the anterior belly of the digastric, this is the posterior belly, this is the central tendon. So, this is, and so this is the base is formed by the chin, base of the mandible, angle of the mandible, and line joining the angle of the mandible up to the mastoid process of the temporal bone. So, this is the base, okay, and this is the other sides. So, this is the digastric triangle. And this digastric, within the digastric triangle, we can get so many structures. Okay, within the small space, we can get so many structures. Okay, in front we can get the fascial artery. Posteriorly, we can get the posterior auricular and other arteries. Okay, and we can get also different nerves, cranial nerves, like 9, 10, 11, 12, all this. 9 means glossopharyngeal, 10 means vagus, 11 means spinal accessory, and hypoglossal. Among them, hypoglossal I will show you in other diagram. This is the superficial one, hypoglossal nerve. That will supply the tongue. So we can get so many nerves. Okay, the vessels, we can get the different vessels. In front we can get the fascial artery, posteriorly we can get other branches of the external carotid artery. Actually, external carotid artery has got so many branches like superior thyroid, ascending pharyngeal, we can get lingual, fascial, occipital artery, we can get posterior auricular artery, and ultimately the terminal branches, that is the maxillary artery and superficial temporal artery. So we can get within this small space, we can get so many structures, and also we can get the submandibular gland, and also the fascial, common fascial vein. So we can get, and also we can get side by side the internal jugular vein. So here we can see the digastric triangle. Here we can see the fascial artery. Okay, and we can get this hypoglossal nerve. We can get the superficial part of the submandibular gland, and here on the base we can get the Omohyoid muscle. That is the base. Okay, so this is the within the small area. Also we can get, this is the lingual artery, this is the fascial artery, this is the common carotid artery, which gives lingual artery, fascial artery. This lingual artery also forms a loop-like structure, which is being crossed by this nerve. That is the hypoglossal nerve. So we can get so many structures within the digastric triangle. So this is another picture of the digastric triangle. We can see this muscle is from the styloid process of the temporal bone to the hyoid. So that is the stylohyoid muscle, which remains just above this posterior belly of the digastric. So as a whole, this is the digastric triangle. So here base, floor, mylohyoid, hyoglossus and middle constrictor. Actually this is theoretical. You cannot see it here. So ultimately you have to, at least you can say this is the mylohyoid. You cannot see the middle constrictor. Okay. So these are the some structures. Now about the carotid triangle. This is the carotid triangle. Okay. So above and in front by the posterior belly of the digastric, above and in front by the posterior belly, and below and anteriorly by the superior belly of the omohyoid, and posteriorly by the anterior border of the sternocleidomastoid. So this is the area where which is called as carotid triangle, and on each triangle has got roof. Roof is common for all. That is the investing layer of the deep cervical fascia. And the floor, within the floor we can find some muscles. This muscle is the middle, this is the inferior middle constrictor, this is the inferior constrictor, middle and inferior constrictor muscles. These are the muscles which are present some of the pharynx. Okay, we can get 3 muscles in the pharynx. They are attached like 3. They are attached one on another like 3 buckets. One is big bucket, that is the inferior constrictor, and within that there is middle constrictor, and most small bucket is the superior constrictor. So 3 constrictor muscles of the pharynx. They are 3. Above one is the superior, then is the middle, and most inferiorly this is the inferior constrictor. Inferior constrictor, middle constrictor. So these muscles will form the base. Roof is by deep cervical fascia, and base by the, that is the middle and inferior constrictor. And also we can get the one muscle from hyoid to the tongue, that is the hyoglossus. So again, here is the triangle we can find. Okay, and also we can find the inferior constrictor, we can get the middle constrictor. Okay, and one muscle here we can get, this is the, below it we can get from sternum to thyroid. So sternothyroid, from thyroid to stylohyoid. Okay, so we can get these 2 muscles. Okay, this also forms the base. Okay, but what is the important content? The most important part of the carotid triangle, that is the branches of the external carotid artery. We know common carotid artery divides into external, one is internal. We are not concerned with the internal because there is no branch in the neck. Internal carotid artery has got no branch in the neck. Okay, though it has got cervical part, then we can get the within the temporal bone, we can get the petrous part of the temporal bone, we can get another part. Okay, within that is called that carotid canal. Okay, so then we can get within the cavernous sinus, cavernous part, then intracerebral part. So there are so many parts, but we are not concerned with the internal carotid artery. We are concerned with the external carotid artery. you can see the first branch is coming down and it is going towards the thyroid gland. So this is called superior thyroid artery. Superior thyroid artery. And one branch is coming out from the posterior aspect, that is called the ascending pharyngeal artery. During our time, we used to say which one is the first branch of the external carotid artery. We used to say the ascending pharyngeal. But now, after doing several dissections, it is now quite apparent that is the first branch is the superior thyroid artery. Superior thyroid artery. Then we can get one loop-like structure which is coming branch, that is called the lingual artery, which will enter into the hyoglossus muscle, and that artery has got part 1, part 2, part 3. Before entering into the hyoglossus muscle, that is part 1. Within the hyoglossus, there is part 2, and when it is leaving the hyoglossus, that is called part 3. So we can get so many branches of lingual artery. I am not going into the detail. Then we are getting the fascial artery. This fascial artery will come out, okay, and it will traverse. There is one very important gland, that is a submandibular gland. It will come in relation to the submandibular gland, and it will come at the base of the mandible. Then it will ultimately hook the base of the mandible just anterior inferior part of the masseter muscle, and then it will become a tortuous, and ultimately it will supply the face. That is the fascial artery. So sometimes what can happen? This lingual artery and fascial artery can come out with a single trunk, which is called linguofascial artery. Linguofascial artery. Okay. Now from the posterior aspect, we can get these two arteries. The below one is directed towards the occipital region. The below one is directed to the occipital region, that is the occipital artery, and above one, here we can find it is going behind the ear. So it is called the posterior auricular artery. Okay. So superior thyroid, ascending pharyngeal, then lingual, then fascial, then occipital, then posterior auricular, and artery will continuously move up, and within the parotid gland, okay, it will enter into the parotid gland. Parotid means around the ear. Parotid. Par means around the ear, the external ear. So we can get one gland, that is a parotid gland. Within that parotid gland, it divides into two branches, terminal branches. They are, one is, we can find here, that is a superficial temporal artery in the face we have seen, and within the parotid gland, we can get another branch, that is the maxillary artery. That maxillary artery is again related to the lateral pterygoid muscle. Either it goes inside or superficial to the lateral pterygoid muscle, and it has got again three parts. Part 1, Part 2, Part 3, and from there at least 15 branches are coming out. From the three parts, ultimately the 15 branches are coming out. Okay. The major branches, that is from the first part, that is the meningeal artery, middle meningeal artery, accessory meningeal artery. We can get the tympanic branch, okay, which will supply the ear, okay. we can get the inferior alveolar artery. Okay, and from the second part, all the muscles, they will supply the muscles of mastication. That means to the masseter, two deep temporal artery, lateral pterygoid, medial pterygoid muscle. And from the third part, we will get other sub branches. They will enter into the nasal cavity. Okay, so we can get so many arteries like superior, and also they will enter into the maxillary sinus, and they will enter into the upper jaw. So those arteries, the superior alveolar, superior posterior, superior inferior alveolar arteries, okay, sphenopalatine artery, like that. I am not going into the details. So just remember, there is one terminal branch, that is maxillary artery. Superficial temporal artery we can see, or even in some person you can see the tortuous artery in the superficial temporal artery. Okay, that is okay. It will supply here. But the maxillary part is dangerous for us because it has got so many branches to remember. Okay. So within the carotid triangle, we can get the branches of the external carotid artery. We can get so many nerves, this ninth nerve, this ninth or glossopharyngeal nerve. This glossopharyngeal nerve will pass, you can see, it is passing in between external and internal carotid artery. This is the external carotid artery and internal carotid artery, and in between this is moving, so that is called, that is the glossopharyngeal artery. It will supply the posterior 1/3 of the tongue, and okay, the sensory and special and general sense. Motor from the styloid process, from the styloid process of the temporal bone. Okay, there are three muscles are coming up. One is from styloid process to the hyoid, stylohyoid. From the styloid process to the tongue, styloglossus. And another muscle is coming out from the same styloid process of the temporal bone from the to the pharynx, stylopharyngeus. So this nerve has got only one muscle to supply, that is stylopharyngeus. Only motor supply to the stylopharyngeus, and otherwise it supplies. It has got either it has got sensory and spatial sense, that is from the posterior 1/3 of the tongue. Spatial sense means taste from the anterior 2/3 by the chorda tympani. The spatial sense, that is by the 7th cranial nerve. So, and whether it is spatial or general sense, all are been carried out from the posterior 1/3 of the tongue, which is also called the pharyngeal part of the tongue, and the supply is glossopharyngeal. This glossopharyngeal not only supplies there, it also supplies the pharyngeal wall. Through there is a pharyngeal plexus. Okay, and also it supplies the tonsil. It supplies the middle ear. So glossopharyngeal nerve, it supplies so many structures. So when there is a tonsillitis, pain is referred to the ear. Okay. So like that, or there is a ulceration in the tongue, we can get pain in the neck, pain in the ear also. So there is a glossopharyngeal nerve. Now we can find this vagus nerve, vagabond's nerve, 10th cranial nerve. It has got so many nucleus of origin. Sob janbe, I will not discuss here. But Here in the carotid triangle we can see this nerve, and this nerve is, you can see, in between the carotid group of arteries and the jugular, internal jugular vein. So in between carotid artery and the internal jugular vein we can get this nerve. So that is the vagus nerve or 10th cranial nerve. It has got so many pharyngeal branch, laryngeal branch, so many branches are there. Okay, superior laryngeal, inferior laryngeal, external laryngeal, so many we can get. We have to make all these branches, no? Pharyngeal branch, external laryngeal, internal laryngeal. Okay, so this is the 10th cranial nerve, and we can get, this is the cranial nerve, which is, we can find at the posterior, this is the sternocleidomastoid, okay, and it supplies the sternocleidomastoid and it is apparent in the posterior triangle of the neck. That is the spinal accessory nerve. Accessory nerve is accessory to the vagus. It has got one cranial accessory component and spinal accessory component. So within the carotid triangle we can get the spinal accessory nerve which supplies the sternocleidomastoid and the trapezius muscle. Okay. And another nerve which is superficial to all, and it forms a loop and it crosses the loop of the lingual nerve. Okay, so that is nothing but the hypoglossal nerve. So we can find these last 4 cranial nerves. We can get so many branches from the external carotid artery. We can get the internal jugular vein within the carotid triangle. Get one interesting thing. We can get the cervical nerves, second and third cervical nerve, and it forms a loop-like structure with the first cranial, the first cervical nerve. Actually, this is the hypoglossal nerve, and it is apparent that this one branch is coming out from the hypoglossal nerve, and it joins with the loop of this nerve. This is called the Ansa loop, or is called the loop, or is called the Ansa cervicalis. Ansa means loop, and it is present within the cervical region or in the neck region. It is called Ansa cervicalis, but it is not at all a component of the hypoglossal nerve. In the next, here you can get the true picture. The green one, it is coming from the C1 segment of the spinal nerve. C1 nerve is coming down. It is passing through the hypoglossal nerve. The C1 nerve also supplies the meninges. C1 means first cervical nerve, which has got meningeal branch also, and it moves hand in hand with the hypoglossal nerve. Okay, it moves hand in hand. Okay, and that component is coming down. Okay, and that component is called the descendant hypoglossal, because it is moving with the it is moving down with the hypoglossal nerve. So that this is actually coming from the C1 segment of the spinal cord. So this is the descendant hypoglossal, and C2 and C3, this is coming down. This is called descendant cervical. So descendant hypoglossal, this one, and this is descendant cervical. So they form a loop. এটা কি মিছিমিছি করলো? ওরা কি মিছিমিছি? ওরা unnecessary they are forming a loop. Nothing is without interest. And we can find this loop where we can get within the carotid sheath. Carotid sheath means this carotid artery, external, internal and the internal jugular vein, they are wrapped with that sheath which is contributed from the deep fascia of the neck. Okay, it is contributed both by the pre-tracheal and pre-cervical, pre-vertebral component of the deep cervical fascia. Okay, so one fascia is around this. We know the femoral sheath. Here we can also get the carotid sheath. The carotid artery and internal jugular vein, they are wrapped with one fascia that is called the carotid sheath, which has got anterior layer, one has got posterior layer, and this loop is embedded within the anterior layer of the carotid sheath. It is embedded within the anterior layer of the carotid sheath. When we are dissecting the carotid sheath, we can get this loop. This is called Ansa cervicalis. Now, this C1 segment, it supplies the superior belly of the omohyoid. Whereas, from the descendant hypoglossal, we can get the inferior. This is supplied by the descendant hypoglossal. Whereas, this inferior belly is by the descendant cervical. And other components like all the stap muscle below the thyroid, hyoid, that is stylohyoid, sternothyroid, thyroid, all are being supplied by this Ansa cervicalis. And you can see the C1 segment is coming hand in hand with the hypoglossal nerve. Ultimately, it supplies the geniohyoid and thyrohyoid. Okay, so remember Ansa cervicalis. What is Ansa cervicalis? It's a loop of nerve which has got one descendant hypoglossal part and descendant cervical part. And this descendant hypoglossal part is in relation to the carotid group of arteries. And this is descendant cervical part which is in close relation to the internal jugular vein. Okay. So, from there we are getting the branches which will supply the infrahyoid group of muscle. What are those infrahyoid group of muscle? Stylohyoid, sternothyroid, thyrohyoid. Okay. But from the descendant hypoglossal, we can get that supply to the geniohyoid and thyrohyoid. Carotid body and carotid sinus. What is carotid sinus? At the bifurcation of the common carotid artery. Common carotid artery bifurcates at the level of upper border of the thyroid cartilage. Okay. So, at the bifurcation, there is fusiform dilatation. That is called carotid sinus. Carotid sinus. What is the function? It is in physiology we learn that is the carotid sinus is a baroreceptor. It can sense the pressure, blood pressure. Okay. So, if there is a pressure, it can sense, it can sensitize our brain. And if there is fall of pressure, it can sensitize our brain. So, or the system. Okay, that is the carotid sinus. And there also we can get one thick swelling like structure, that is a carotid body. That carotid body is nothing but the chemoreceptor. If there is a fall of hydrogen ion concentration, or if there is a rise of the bicarbonate, they can sense. So that is called carotid body. So that is called chemoreceptor. Baroreceptor and the chemoreceptor. So they are in relation to the carotid triangle. The chin we are getting on either side. This is the anterior belly of the digastric and based by the hyoid bone. So this triangle is called the submental triangle. Okay, and on the base we can get the mylohyoid muscle, and here we can get median raphe, and also we can get other structures, that is the submental group of lymph nodes. Okay, and anterior jugular vein or jugular venous arches. This is the anterior jugular vein, and here we can find the anterior belly of the digastric. This is the posterior belly. So the anterior belly, and this is the hyoid bone. So this is the submental triangle, submental group of lymph nodes, and this is the anterior jugular vein and anterior jugular venous arch and median raphe, and base is formed by the mylohyoid group of muscle. So this is anterior triangle. The last point, very important point. This is the anterior belly, this is the posterior belly. What is the nerve supply of anterior belly? And what is the nerve supply of the posterior belly? Whether they are the same muscle, so they should have same supply. Yes or no? Anterior belly and the posterior belly of the digastric muscle. Ultimately there is one muscle, so it should be supplied by same nerve, one nerve. Tell me whether it is been supplied by the same nerve or different nerve. Different or same? Different. Majority in favor of different. Yes, this is supplied by the different nerve. The anterior belly, it is this muscle is actually is a component of the first pharyngeal arch, whose nerve supply is mandibular division of the trigeminal. So it is supplied by the mandibular division of the trigeminal nerve. Only mandibular division has got motor supply, in addition to the sensory supply. And other three components, ophthalmic division, maxillary, they don't have any muscular supply. Only the mandibular division has got muscular supply. And this muscle develops from the first pharyngeal arch, whose nerve supply is mandibular. And the posterior belly, it is been supplied by it develops from the second pharyngeal arch, whose nerve supply is fascial nerve. The cervical branch of the fascial, bolechilam, cervical branch. That cervical branch will supply this muscle. Okay, this muscle, and also that is stylohyoid. Okay, stylohyoid, from the styloid process of the temporal bone, three muscles are coming. One is stylohyoid, stylopharyngeus, going towards the pharynx, and styloglossus. Styloglossus by all these muscles, though they are taking origin from the same styloid process of the temporal bone, their destiny is different. Okay, and the nerve supply is different. Stylohyoid supplied by fascial, stylopharyngeus by the ninth cranial nerve, that is glossopharyngeal, and styloglossus, tongue, supplied by
hypoglossal. 7th, 9th and 12th cranial nerve.